Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Interstitial lung diseases, and we are going to look at the HRCT findings. So the first one, we'll be looking at the idiopathic pulmonary fibrosis. So what is the idiopathic pulmonary fibrosis, or the usual interstitial pneumonia, or the usual interstitial pneumonia? So how is the pattern here? Here it forms a honeycomb pattern. So there is a honeycomb pattern, and there are presence of the reticular shadows. So reticular shadows are present. There is a traction bronchiectasis, as well as the complete loss of the lung architecture. There will be a complete loss, and this is of the lung architecture. Next, what is involved is the absence. So next is there is involvement of the absence of other non-specific findings. So absence of the non-specific findings such as the ground glass opacity, the nodules, the cyst, as well as the consolidations. Next, we move on to the non-specific interstitial pneumonia. So in terms of the non-specific interstitial pneumonia, so this will have an extensive ground glass appearance. So there is an extensive ground glass appearance, and there is also the presence of the subpleural sparing. So there will be subpleural sparing. So here the subpleural sparing is specific but not seen always. It is very specific, but it is not seen always, the subpleural sparing. Next, we look at the COP. So what is meant by the COP? COP means that there is a cryptogenic organizing pneumonia. So it's cryptogenic organizing pneumonia, and this has the presence of a patchy. So cryptogenic pneumonia, it has presence of a patchy consolidation. So there is patchy consolidation, and this is the presence of a bronchogram with the air bronchogram. Next is the reverse halo. So there is presence of a reverse halo, or also known as the atoll sign. So the reverse halo or the atoll sign, there is a ground glass area surrounded by a peripheral consolidation. So there is a ground glass area. So there is presence of a ground glass area, and it is surrounded by the peripheral consolidation. So it is surrounded by the peripheral consolidation. So this is with the COP, that's a COP. There is a reverse or the halo sign. Next is the lymphocytic infiltration. So lymphocytic infiltration pneumonia. So we are writing it as LIP. So L here stands for the lymphocytic lymphocytic interstitial pneumonia. So they have presence of the thin-walled cyst. So thin-walled, it is thin-walled cyst, and they have a centrilobar nodules. They have presence of the centrilobar nodules, lobular nodules, and there is also presence of the ground glass opacities, presence of the ground glass. So there is presence of the ground glass opacities. Next is we look at the respiratory bronchiolitis relative interstitial lung disease. So in terms of the respiratory bronchiolitis, so respiratory bronchiolitis and related to the ILD, that is interstitial lung disease. So what does this have? This has the centrilobular ground glass nodules. So it contains the centrilobular ground glass nodules. Next is the bronchial wall thickening. They also contain the bronchial wall thickening. Next, we move on to the acute interstitial pneumonia. So the acute interstitial pneumonia. So in acute interstitial pneumonia, there is a presence of the diffuse patchy ground glass opacities. So there is a diffuse patchy. So there is diffuse, there is patchy ground glass opacities. Then we move on to the desquamated interstitial pneumonia. So there is desquamated interstitial pneumonia. So desquamated interstitial pneumonia, it presents with the patchy ground glass opacities. So there is presence of patchy ground glass opacities. So what are the other forms of the ILDs? The other forms, it includes the LAM. LAM stands for the lymphangioliomyomatosis. So let's write it down. Lymphangioliomyomatosis. So this is nothing but a regular thin-walled cyst. It is a regular thin-walled cyst. So next we look at the PAP. So what is meant by PAP? PAP stands for the pulmonary alveolar proteinosis. So what is the PAP? So PAP, it has again a ground glass. It has a ground glass opacification. So ground glass opacification, and there is a superimposed septal thickening. There is a superimposed septal thickening. And this is known as the crazy pavement. This is known as a crazy paving type. So it is a crazy pavement type, and it is characterized as it is not diagnostic. So it is characteristic, it is not diagnostic. Then we move on to the PLCH. The PLCH. So in terms of PLCH, it is nothing but the pulmonary Langerhans cell histiocytosis. It is nothing but the pulmonary Langerhans cells histiocytosis. So pulmonary Langerhans histiocytosis is that is PLCH. There is bilateral irregular shaped cyst. So there is bilateral irregular shape. So there is bilateral irregular shaped cyst, and they contain nodules. So there is an irregular cyst, it contains nodules, and it is predominantly present in the upper lobe, that is the UL. To learn and grow daily like this, please do subscribe.